Today, I want to play around with pelvic mobility. What does that mean? I want us to take a moment and see, can we get our pelvis to move without moving the rest of our body? What that looks like, so your pelvis, right here, can you get it to move different ways without everything else coming along for the ride? So to help us with that, let's talk about some bony parts of our body. Right here, we have our pubic bone, the front of our pubic bone. Then we have, right here, our sticky outy bones, or our ASIS. And then we have our sacrum and our tailbone down at the bottom. First, let's find what the middle looks like. So not overly arched, not overly tucked, but the middle. To find the middle, or neutral, you find your pubic bone here, find your sticky outy bones, and can you get them to be flush with one another? Then, can you get your pubic bone, with just your pelvis moving, to go back behind your sticky outy bones? Can you do that without your back generating the movement, or your shoulders trying to do it, but can you get your pelvis to generate that move? Now, yes, you may feel it in your low back, but can you make your pelvis generate that move versus the low back muscles? Let's go the other direction. Can you get your pubic bone to come in front of, right there, your sticky outy bones? Can you do it with your pelvis generating the movement versus you trying to crunch to make it to happen? That's just getting curious to see, can it be independent? Now you might feel it in your core when you do this. That's fine, that's normal. But what starts the movement? If you're having a hard time finding it when you're just straight up and down, sometimes it helps to have some sensory feedback, some input in our body. One way to do that is laying on the ground. So when you lay down, find that neutral position. So getting things lined up, pubic bone, sticky outy joint bones, your ASIS. Can you feel them? Okay. Now can you, kind of almost like you're imagining water sitting in the bowl, in your pelvic bowl, can you get that to spill towards you? And you might feel your low back push into the floor a little bit, but that shouldn't be what's generating the movement. Pelvis should be. Can you get it back to the middle? So water just sitting here. And then can you spill the water out towards the wall? Can you go back and forth? Sometimes it's nice to do it on the floor because it keeps your shoulders from trying to get your pelvis to move. I know it might sound funny that your shoulders may try to get your pelvis to move, but for those of you who experience it, you know exactly what I'm talking about. So once again, using the floor is one of my favorite ways. Now, if you're having a hard time feeling it coming from the pelvis, can you get your pelvis to move with your feet? Let me tell you how. So think about pushing your feet away from you without actually moving your feet. So you're just pushing into the ground. See what happens to the pelvis when you push away? It does that little tuck where your pubic bone's now higher than your ASIS. Now then, can you pull your feet towards you? And it can get your pelvis to move. So if it's really hard with just thinking about your pelvis to get it to move back and forth, you can use your feet to push away and pull towards to generate that movement to help you identify what I'm talking about. Now, if it's hard for you to get on the floor, or if you want another way to explore, you can do it against a wall. So what that looks like is standing up against the wall, letting your sacrum go against without flattening your low back, but just letting it go. You should have a slight arch in your back, almost enough to kind of put a hand through back behind here. Can you tuck? Can you go to neutral? And can you get your pubic bone back behind your sticky outy bones? Just another way to give sensory feedback to figure out, can you move your pelvis? Can you generate movement without everything else coming along for the ride? Give it a try. If you're feeling stuck or if things are feeling stubborn, let me know. It's fun to just Let yourself be curious about what your body can do. And it doesn't mean anything's wrong with you if you can't. Just I encourage you to have some fun and see what you can do.